Gentlemen, let's talk about something most men won't discuss openly, but almost every man over 50 wonders about what really happens to your body when you go through a long stretch without sexual activity. Maybe you've been single for a while, maybe health issues have changed things, or perhaps life just got complicated and intimacy took a backseat. Whatever the reason, you've probably heard the phrase, use it or lose it, and wondered if there's any truth to it. I'm Dr. Jocelyn, a urologist with 12 years of experience. And today I'm going to give you the honest science-backed answer. And I promise you, much of what you've heard is completely exaggerated. But there are some real changes that happen, and it's important you understand them. Stay with me because by the end of this video, you'll know exactly what's myth, what's real, and most importantly, what you can do to maintain optimal health and vitality, whether you're sexually active right now or not. Let's start by clearing up the biggest myths I hear in my office almost every week. Myth number 1. If you don't use it, it'll stop working completely. Here's the truth. Your body doesn't just shut down because you've taken a break from sexual activity. You're not going to wake up one day and find that everything has permanently stopped functioning. Your tissues, your nerves, your hormonal system, they're all remarkably resilient. Myth number 2. If I go too long without sex, my libido will disappear forever. Again, not true. Yes, hormones and psychological factors play a role, but taking a break from sex doesn't doom you to a lifetime of zero desire. Your body is adaptive, and desire can and does return when circumstances change. Now, here's what is true. There are some real measurable changes that can happen to your body during extended periods without sexual activity. These changes aren't catastrophic, but they are worth understanding so you can take simple, proactive steps to maintain your health. Let me walk you through the biology in plain language, no medical jargon. Your entire reproductive and urinary system depends on 3 things: blood flow, muscle tone, and hormone levels. Think of these as the 3 pillars holding everything up. When you have regular sexual activity, whether with a partner or by yourself, you're essentially doing maintenance work on all 3 pillars. Sexual arousal increases blood flow to the pelvic region. That increased circulation keeps tissues healthy, elastic, and well-nourished. It's like watering a plant. The tissues stay supple and responsive. When you reach climax, your pelvic floor muscles contract rhythmically. These contractions are like a natural workout for those muscles, helping them stay strong and toned. Strong pelvic floor muscles are critical, not just for sexual function, but also for bladder control and overall core stability. And finally, sexual activity interacts with your hormones in complex ways. Testosterone, the key male hormone, influences desire, energy, and even mood. Regular activity helps keep these hormonal pathways active and responsive. Now, I know some of you are thinking, okay, so what actually changes if I'm not sexually active? That's exactly what we're about to cover. But first, quick pause if you're finding this helpful. Hit that like button, subscribe to the channel so you don't miss future content on men's health, and drop a comment below. Tell me, where in the world are you watching from? I love seeing this global community of men taking charge of their health. Let's break down the 4 most common changes men experience during extended periods without sexual activity. Change number 1, blood flow and tissue health. The biology. Your penile tissue contains something called smooth muscle. This tissue needs regular oxygenated blood flow to stay healthy and elastic. During an erection, blood rushes into the tissue, stretching it and keeping it flexible. When you go for long periods without erections, and this includes nighttime erections, which are actually nature's way of doing maintenance, the tissue can start to lose some of that elasticity. Think of it like a rubber band that hasn't been stretched in a while. It still works, but it might feel a little stiffer at first. The practical reality. Some men notice that after a long break, erections might feel less firm initially, or it might take a little longer to achieve full hardness. The good news, this is usually temporary. Once you resume activity, blood flow improves, and tissue responsiveness typically returns. The emotional impact. This can be worrying the first time it happens. You might think something is permanently wrong, but understanding that it's a natural, reversible response to decreased activity can ease a lot of anxiety. Change number 2, pelvic floor muscle tone. The biology, your pelvic floor muscles, the ones that control urination, support your bladder, and play a role in erections and climax, benefit from regular contractions. When you orgasm, these muscles contract rhythmically, keeping them toned and strong. The practical reality. When you're not sexually active, you might notice subtle changes in bladder control. Maybe you feel a slight urgency you didn't feel before, or occasional minor leakage when you cough or sneeze. Change number 3, testosterone and hormonal balance. The biology. Testosterone levels naturally decline with age, but regular sexual activity helps keep the entire hormonal system engaged and responsive. Some research suggests that men who remain sexually active tend to maintain slightly better testosterone levels. Though the relationship is complex, the practical reality. During long stretches without activity, some men notice they feel less motivated, less energetic, or just generally flat. Libido can decrease, which creates a cycle. Less desire leads to less activity, which can further decrease desire. The emotional impact. This can feel like you're losing a core part of your identity. Many men tell me they feel less confident, less masculine, but understanding that this is often hormonal and therefore treatable can be incredibly reassuring. Change number 4, psychological and relational effects. The biology. Sex isn't just physical. It's deeply connected to mental health. Regular sexual activity has been linked to lower stress levels, better sleep quality, and improved mood. Partly because of the release of hormones like oxytocin and endorphins, the practical reality. Men who go through long periods without intimacy sometimes report feeling more stressed, more isolated, or experiencing poorer sleep. If you're in a relationship, lack of physical intimacy can create emotional distance, the emotional impact. This is often the hardest part. Sex is about connection, vulnerability, and feeling desired. When it's absent, for whatever reason, many men feel a profound sense of loss. Here's the most important thing I want you to hear today. For most men, especially those who are younger or in their 50s and 60s with reasonably healthy hormone levels, these changes are not permanent. Your body is remarkably adaptive. When you resume sexual activity, whether with a partner or through self-pleasure, blood flow improves, tissues regain elasticity, muscles strengthen, and confidence returns. However, if you're dealing with significant age-related testosterone decline, or if you have underlying health conditions like diabetes or cardiovascular disease, the changes can be more pronounced and may require medical support, and that's completely okay. There's help available. Whether you're currently sexually active or not, here are 4 practical steps to maintain optimal health. 1. Stay physically active. Cardiovascular exercise improves blood flow throughout your entire body, including the pelvic region. Strength training helps maintain testosterone levels. Flexibility work supports overall function. Even a brisk 30-minute walk daily makes a difference. 2. Practice pelvic floor exercises. You don't need to be sexually active to keep these muscles strong. Simple keel exercises, contracting and releasing the muscles you use to stop urination, can be done anywhere, anytime. 3 sets of 10 repetitions daily is a great start. 3. Consider solo activity. Even if you're not in a relationship, maintaining regular sexual function through self-pleasure helps preserve blood flow, muscle tone, and hormonal responsiveness. There's no shame in this. It's legitimate health maintenance. 4. Get your hormones checked. If you're experiencing persistent low energy, decreased libido, or mood changes, ask your doctor to check your testosterone levels. If they're low, hormone replacement therapy might be appropriate and can dramatically improve quality of life. While most changes are normal and reversible, there are a few warning signs that require prompt medical attention. Sudden, complete loss of ability to achieve erections, even erections, pain or discomfort with erections or ejaculation. Significant changes in urination like severe urgency, pain, or blood in the urine, profound fatigue, depression, or other symptoms that interfere with daily life. Remember, erectile dysfunction can be an early warning sign of cardiovascular disease. If you're having persistent issues, don't ignore them. They could be your body telling you something important about your overall health. I want to address something that doesn't get talked about enough, the emotional weight of these changes. Many men tie their sense of masculinity, confidence, and self-worth to sexual performance. So, when things feel different, it can trigger deep feelings of inadequacy or shame. You might feel like you're becoming less of a man or that your best years are behind you. Let me be clear. Your worth as a man is not measured by sexual frequency or performance. Your body is doing exactly what bodies do. It's adapting to circumstances. And with the right understanding and sometimes simple interventions, you can maintain vitality and function for many, many years to come. If you're not currently sexually active because of circumstances beyond your control, maybe you're single or your partner has health issues, you haven't done anything wrong, and you're not somehow failing. Life happens. What matters is that you take care of your overall health and stay informed. So bottom line, do you use it or lose it? The answer is not in the catastrophic way most men fear. Yes, your body benefits from regular sexual activity through what matters most is that you listen to your body, stay informed, and don't let fear or shame keep you from seeking help when you need it. Your best years don't have to be behind you. With the right approach, you can maintain vitality, confidence, and function well into your later years. If you found this helpful, please share it with someone who might benefit, a friend, brother, or father. Leave a like to help this message reach more men, and subscribe to the channel with notifications on so you don't miss future content on men's health. Remember, age doesn't define your vitality. Small, informed changes can bring real freedom and confidence. I'm Dr. Jocelyn, and I'll see you in the next video. Stay healthy, stay informed, and most importantly, stay confident.